The biggest news from Week 6 in the NFL was Aaron Rodgers leaving Sunday's game with a broken collarbone on a tackle by Vikings linebacker Anthony Barr. Time now for an injury report presented by Midwest Orthopedics at Rush, the fifth-ranked orthopedic group in the nation. It's how orthopedic care should be. We now welcome in Dr. Anthony Romeo, shoulder and elbow specialist and orthopedic surgeon. And we don't know exactly how long, if he's going to be out for the rest of this regular season, Doc. But what do you think the time frame is for an injury like this?
Well, initially we didn't know how severe it was, so there was a question about whether it would be treated with or without surgery. But we've heard today that the physicians feel it should be treated with surgery. This means the fracture is displaced or not aligned properly, which means they'll have to open it up, put a plate and screws on it, and then hold it in place. So in terms of the average return back to work in the NFL at this level with a clavicle fracture, it's about 5 or 6 months.
Whoa.
But the quarterbacks take up to almost a year when it's their throwing shoulder.
Wow, and that's the difference here. In 2013, he had the non-throwing shoulder clavicle issue, and he was only out 7 weeks. That's not going to be the case now with the throwing shoulder, right?
That's correct. See, this is a clavicle right here, and so when the player gets driven into the ground as he was, then what it usually happens is it fractures right here in the middle of the collarbone. And then this bone rides up and over the top of the other one, and it shortens the shoulder, which will reduce some of the function. So the surgeons will have to move this apart, line up these two edges, and put a plate with 6 or more screws in place to hold it in place.
Okay, this could be a long recovery then for Aaron Rodgers. So probably prognosis not very good for coming back this regular season. This injury report was presented by Rush, Midwest Orthopedics, the fifth-ranked orthopedic group in the nation. It's how orthopedic care should be.